Hey everyone, it's Antoinette, your visionary nurse, and welcome back to the Visionary Nurse Podcast. Stay tuned. So hey everyone, it's Antoinette, your host of the Visionary Nurse Podcast. It's so great to have you all back again. It's been really cool just having these episodes coming up in 2023. A lot of it has been about community engagement and just recognizing how much can be done across sectors. For those who've been tracking with me for a little while, the Visionary Nurse Podcast, just to give you a little bit of a background, it's to accompany the work I do as a community health consultant and coach and mentor for nurses, and that often goes beyond. And it's just designed to educate, uplift, and support each other as we dare to be influentially visionary. There's so many different shifts in healthcare, and many are looking to innovatively expand their knowledge in a variety of settings. And right now, it's more important than ever to create sustainable and collaborative changes that cross sectors, influence access to care, business growth, the operation of organizations and institutions, and just how we navigate the many changes in our society. So I always like to find opportunities to speak to those things. If you've caught a couple of the episodes that I've had in the last couple of months, one of them was with the Community Engagement Director of BMW Pro-Am, and then also of RISE Prevention, just looking at how to curtail drug abuse and misuse in the teenage population. So just looking to continue that theme, looking at the importance of community engagement and partnership, and especially in rural areas. Now more than ever, innovation in rural areas is such a hot topic, and finding these alternative touch points to address care is definitely where we're at. And something that's kind of a sweet spot for me right now is the library. If you haven't rocked with me for a while, I'm always talking about the local library. I'm always talking about the great work that can be done there. I mean, you got free books, you got free resources. Why not give a little bit of free healthcare access there too? So as a result of just thinking about the library as an alternative touch point and just the community health that you can do, I've gotten a chance to connect with a little bit of a hub or a collaborative that I've been forming in a rural area in Lawrence, South Carolina, where we've been surrounding some efforts around the local library. And so I have the privilege to welcome in some of those folks that have been hanging with me, and we've been getting a chance to chat and think about how we can use the library in a way that could really reach areas where you don't always have traditional healthcare access. Maybe you're not in an urban area. Maybe you're in an area where, providers are few and far between. So looking at what are some innovative and alternative ways that you can address community health, that you can address community healthcare in a place that you may not usually think about. So I'm so excited to invite my guests to jump in. I'm going to give them a chance to kind of do a little round table introduction of themselves, and they're going to be able to share their perspective. They've all been excellent and wonderful people, just responding to just about anything and everything that I try to throw out there, and they have such a heart for community health. So I think you're going to really enjoy this episode. But if you guys can just jump in, and I'll start, just from the top, but if you can just introduce yourselves, a little bit of what you do, your organization, and then we'll kind of dive into the conversation of just the innovation behind using libraries as an alternative touch point for community health. So Maddie, I'll start with you.
Thank you so much. And hello, everyone. My name's Maddie Lee, and I'm the Communications and Marketing Director for the American Heart Association in the upstate local market. So that has been such an amazing opportunity, definitely younger in my career. And I've really enjoyed being here with the American Heart Association for the past 9 months, and then specifically being able to work in the upstate community as well. So the American Heart Association is coming up on its centennial. So 2024 will be 100 years of the American Heart Association. So it's been really amazing to be able to see all of the impact, the change, the research, the policy, the advocacy, all of the elements that comes with focusing on and prioritizing heart health, as well as our entire well-being as human beings. And learning that mission, being a part of this organization is so empowering at times, but also allows me to recognize a lot of the difficulties that our local community faces. So I'm excited to continue to have this discussion with you here all today, and to grow and learn and support each other, just as Antoinette mentioned earlier.
Awesome. Thank you, Maddie. And it's always so great, again, just thinking about, and we'll talk through it, some of the ways that you can cross over and use the resources that you have in your community in places that you may not have thought before. And, obviously this couldn't be done if we didn't have the library. We couldn't have that partnership. So Renita, if you could just kind of jump in and tell a little bit about your role, I think this is going to be the tie to why we're even doing what we're doing. So.
Hello, everyone. My name is Renita Bartstell, and I'm the Library Director for Lawrence County Public Library System. I've been here since 2021. However, I've been a part of the library since 2007. So I've been in the field for a while. I've worked in different states, North Carolina, Tennessee, and now South Carolina. And one of the cool things about me going throughout my journey as a library director is learning that rural areas do not get the health care that they need. And I see that issue every day, because of the thing is, if you're in the urban areas, you get all of those resources, you get all of those nonprofits, you get all of that because it's right there in that area. But when you're in a rural area, things are all over the place. And so the goal is my goal is to basically become the hub of the community, have those spots. So if they need something on, like maybe high cholesterol, need to learn about that. Guess what? I want my library to be that hub so you can get those resources, so you can learn and grow. Our mission is to educate, empower, and entertain. So that's the thing that I want my library to be that hub, so we can help out those situations. Because I see it here. We're a food desert. I see those issues every day. And so my goal is to be that library, to have those resources that our community needs. And one of the things that I'm also passionate about is just helping my staff. The thing that makes me so excited is when I see my staff grow as well, because we're just not librarians. I always tell my team, we're more than just this building. We are here to help people learn and grow and empower them. So I'm just excited to be a part of this podcast today.
I love it. I love it, Renita. And definitely your energy has been such a key portion of getting this together. And I think that's so important. We'll talk about this, a little bit later on, just thinking about partnerships, right? A lot of times you can have great ideas, and it's something I always like to say. I'm a big forward thinker. I like to come up with a lot of ideas, but if you don't have the right partnerships behind it, those ideas are going to float around in space and may never land. And so it's so key when you can find the right people, the right partnerships, and the right situations to kind of push some of those visions forward. So I've always appreciated your energy, and I'm really looking forward to thinking how we can continue to unpack that, but just also to spark, others' interest who may come across this podcast. They might say, hey, I'm not in healthcare directly, or here I am in my little area and I'm not really sure, but I have big ideas. I have a lot of energy. I want to see things change. I see around me the different ways that I can be a resource. And so it's just being able to unlock that, partner with those who may have what you need, and then just go from there. So it's always been really great to think about that. And I'm really excited for people to get a chance to hear a little bit more about your background as we talk about it too. So thanks for being a part of it and just making the conversation happen. So someone who is not a stranger to the Visionary Nurse podcast, has been on it before, probably about 3 or 4 episodes at this point, has always been such a great colleague and really thinking outside of the box with me, probably for the past 5+ years since I've started this journey. Deidre, if you could talk a little bit about your background, what you do, and just kind of what you bring to the table.
Hello, everybody. It's Deirdre Stewart, and I am a licensed clinical social worker. And glad to be back with Antoinette. It's been a while, but I always enjoy our times together. I am a mental health practitioner. I specialize in trauma, so I provide therapy for individuals, groups, families, and couples. But in this capacity that I'm in today, not only do I represent mental health, but also the local Healthy Lawrence Coalition, whose main goal is to bring together like-minded people to bring about change in our community, because we're recognizing the disparities that are present in our community, and we're working together with other agencies, other professionals, and we're reaching out into the community very soon to not only discuss the data and what we found out, but how to address these issues with the real people that are actually dealing with the disparities. So I'm excited about what's to come and hopefully making a huge change policy-wise, what we provide to our community, how we do it, making it better, making it more accessible to everyone, because everyone deserves proper health care.
I love it. So good. And definitely, shameless plug, go back and listen to some of the episodes. If you have not heard the Visionary Nurse podcast before, if you're new to this podcast, some of the early episodes at the beginning of season 1, I think, check out Deidre Stewart's work that she does with Hope Unlimited LLC, and just a little bit of education on mental health. We have a portion in there where we did a 3-episode series just talking through mental health, especially during the main height of the pandemic, how parents and children and families could really navigate some of those stressors a little bit better. So I'm always out for educating. That's a big portion of what I do, and I've always appreciated Deidre being a part of those conversations. Last but not least, I like to say that Hannah's my hype man in a lot of ways. She always keeps me plugged in. But Hannah, if you can share a little bit about your background, what you do, and then after you finish that, if you don't mind segueing into maybe some of the challenges that you've seen, because I think we've worked together quite frequently in this area. We've both encountered different challenges in terms of, the things that you want to do and sometimes the things you run up against, or some of the biggest needs. But just tell a little bit about your background and then maybe some challenges you've experienced in your role.
Thanks, Antoinette. You are such a visionary for our communities and that we serve. And so it's a privilege to work alongside you, and your vision that you really do have for our counties to improve access to health is just commendable. So it's always a pleasure to work alongside you. I'm Hannah Roberts, and I am a registered dietitian by trade. I work for a program in the state of South Carolina called SNAP Ed. It's under Clemson University, and I am their community health coordinator. So SNAP Ed at large, if you're not familiar with what this program is, it's a federally funded program, evidence-based, that helps lead healthy, active lives through a combination of educational strategies, social marketing, and then interventions to improve policies and systems and environments. So you kind of trickle that down. Our mission within Clemson is really to look at how do we build capacity by providing opportunities for eligible communities to improve the health outcomes of healthy eating and active living through evidence-based sustainable interventions. So within my role as the community health coordinator, I'm really looking at the PSC side of things, so that policy, system, and environmental changes. And within that, I look at state and local partners and how we can support multi-level community and public health interventions that facilitate healthy eating and physical activity for our SNAP eligible individuals and communities with a significant low income population. So if you're not familiar with the state of South Carolina, I would say predominantly we're a rural county, and as Renita alluded to, Lawrence County is significantly just in a dead spot of access to food and transportation and physical activity resources. So we look at that within our program and look at how do we work alongside partners, so like the library, like individuals with Antoinette and American Heart Association, social workers, all of the like, and just how we can come together to improve the health of our communities. And so as Antoinette said, what are some of the biggest challenges that we experience in my role, particularly in community? I would say that a lot of that is led to lack of infrastructure for healthy food and physical activity to reinforce the messages that are taught in classes. I think that as well as transportation, but we do so direct education in a lot of our line of work, and we teach about how do you eat better, how do you get more physically active, all while on a budget. But then thereafter, my role is looking at that sustainable change to really drive behavior change. But if we don't have the infrastructure to be able to support that, it is a challenge for us to think through that long-term impact within the community. So I think looking at opportunities for access to food and access to places to exercise. When you're thinking about rural counties, the transportation is just a barrier to be able to get to spots like that. So the library, like Antoinette said, it really is a hub that can provide an access point for people to be able to gain healthy produce and to maybe rent out some physical activity equipment and things like that.
Yeah, and it's definitely, again, when you live in these rural areas, it can get tricky thinking about how can you do things effectively, how can you do things sustainably, and cross-sectoral collaboration is a word I love to throw around, and that's such a major component of that. It's hence why we even have this conversation, and it's one of those things that I think, if anything, and anyone can speak to this, especially when we kind of came through the pandemic years, we all had to think outside of the box. Nothing could be business as usual. The way we wanted it to be, the way we wanted healthcare to be, the way we wanted general systems to run. And if anything, it really shook things up. And I think it was so necessary. Number one, it uncovered maybe some issues that had been buried for a really long time, but it also helped, others kind of think about, where can I fill in the gap? Where can I partner with someone where I may not have partnered with them before in order to, execute some of these things? And I know, maybe Maddie can talk about some of the partnerships with AHA, but Renita, if you can give a little bit more of just, your insider scoop, because you've done these kinds of things before. I know you've had previous experience in the foothills of North Carolina, right? And maybe even Virginia, possibly. You've been in very, very rural areas. Like, our area is rural, but yours is, I think, to another level rural. So I don't know if you can talk about maybe some of the things that you organize with other libraries and things that you've, been able to implement now. And then maybe, Maddie, you can speak to, partnerships that exist in other areas, whether it's through AHA or things like that, when you think about, how do I step outside the box?
One of the things that we had to do when I was in Tennessee, I realized that we had some issues with people not getting dental or eye care. Because of the fact that a lot of the people lived on hollers. I had to learn what a holler was because I didn't even know what a holler was, but a lot of people, that's the side of the mountain. So a lot of times what happened was these people were living on these hollers and they wouldn't come down unless they had to go to the grocery store. So they didn't get dental or healthcare, period. It was, let's do the essentials. If my tooth was hurting, I'm going to pull it out myself. Mm-hmm. That's what I was dealing with in Tennessee. So what I did was I reached out to remote area medical center and I said, hey, I have these people that need some help, but they're not going to go to the doctor. Most of them don't have health care. So how can I help them? And so what I did with the remote area clinic was they came down, and for one day, anybody could come with no insurance to get their teeth cleaned, pulled, or even get glasses. So the maximum they could pull teeth up was 8. So we had some people who wanted all their teeth pulled at one time. And I was like, I can't handle that. But it was fantastic that people were getting dental cleanings that they haven't had them in years. One woman cried because she hasn't had glasses in years, and she said she couldn't see, but she was just driving down the mountain, which is scary in itself if you're living on a holler. But to get that type of treatment and not to have insurance, that was just a blessing. On top of that, they walked out with free eyeglasses on the spot. So we checked their eyes. Then they had glasses within 30 minutes. That was, I felt like that was amazing. We helped over 100 people in that situation. Also, just different types of partnerships throughout, like our partner with Lions Club. Because one of the things about being in a rural situation in North Carolina and in Tennessee, we didn't have a budget. We had a budget, but it wasn't a real budget. We had enough to keep the doors open, buy books. So these things that I was seeing, I didn't have it in my budget to help. So those partnerships throughout the community was the reason why I was able to get these things done. I would be like, hey, I went to one of the dentists. I was like, if I can get this organization to come, will you be able to help pull some teeth? Those partnerships were able so we can help our community. And that's the challenge of being in a library, because we get a budget. However, that budget, a lot of our commissioners and our elected official wants that budget to be used for the traditional ways of the library. However, the library is not traditional anymore. We're not about just books. We are now we're not social workers, but we are kind of having that hat of that umbrella of social workers because they're coming to us for a need. And so, in that need, we have to figure out how we can help them. Also in North Carolina, I had the same situation. I was in rural North Carolina. So I had to figure out how can I get someone to come in. So I also was able to partner with a social worker to come in and help with their needs. Because a lot of times what people are looking for, we can't diagnose you. We're just librarians. So I could get that social worker to come in and say, okay, this is what the doctor is talking to you about. So they can understand that result. Because sometimes when you get a result of you have cancer, all thing you hear is cancer. You don't know what else. You're not hearing anything else when the doctor says cancer. So with that social worker or that nurse, they can go back in and say, this is what they're telling you. Because in Tennessee, I had a social worker advocate at my library. So they would go in and help. So I had a person who came in and said, hey, I got a bad diagnosis. I don't understand what it means. That person came from behind my circulation desk, talked to that person, said, hey, can I read your results? Because first you had to ask for permission. And they were like, yes. After that point, they were like, well, can I come to the doctor's visit with you? So, because I understand that you're not understanding what they're saying. It's going in one ear and out the other. And they gave that person the okay to go to the doctor. So then after the meeting, after the doctor's visit, they can have that conversation so they can break it down to that patron. And this is what we need throughout. I really strongly believe this is what we need in our rural communities, because of the fact of the matter is a lot of our rural patrons, our rural citizens don't understand what's happening, or they don't have the resources to understand what doctors are saying because they're just in shock. And so to have that advocate to be with them or to encourage them just to go to the doctor is very important in this rural area, because a lot of times our young men do not go to the doctor. They don't have someone to push them. They go after the fact something's not right. So we need that situation in the libraries, in rural areas, to push our community to go to the doctor so it's not too late.
That's so good. So good. And I think if anything, for those who have been on the fence about trying to find an alternative touch point, if you haven't thought about the library, hopefully I will convince you by the end of this conversation. But you spoke to so many amazing things. Number one, just thinking about some of the non-threatening environments that the library can provide, right? So if you receive some type of major diagnoses, you don't know anyone else who knows what to do with that, but you can find kind of a non-threatening area where traditionally you would not think of it as where you could receive some type of support. But at the same time, people frequent the library. Patrons come to the library for so much beyond books. You have free computer access. You have resources for kids. You have things that you can learn up on. I know, especially when I was starting off with my business, like full transparency alert, I went to the business section and checked out every single book the library had to offer on anything and everything about business. Because again, I'm in nursing. I wasn't thinking I was going to go into business, and it was a whole other area that I ventured into. But I spent many a days in the library just learning from that. And there's so many other things that come with it. So not only just the resources that are available, but how you can kind of capture audiences that may not be somewhere else. Maybe they're underinsured or they'd have no insurance at all. I know there's several other libraries as well that I've gotten a chance to connect with and partner with that are doing, just like what you would see at a major grocery store, things like blood pressure cuffs in the library, things like education that's there. And, maybe Maddie, you can speak to some of that in terms of with the American Heart Association, but we've been connecting with the American Heart Association over the last several months as well, and thinking about, some of these major things. In rural areas, hypertension is a major issue. High cholesterol is a major issue. Mental health is a major issue. And all of these different things, Renita, in conversations that we've had before, you've spoken to all these different situations that you as the librarian have had to address, whether it's teens that come from the local schools that, have different issues going on, to anyone who's just looking for general information from, job employment to anything else that comes with it. And again, we've recognized that there's so many different components that affect health outside of health, right? It's where you eat, work, sleep, play. Everything that comes with that is going to impact your physical health as well as everything else in between. between. So finding these ways to kind of incorporate it into it, I commend you for diving in there with no budget, and being a forward thinker in that. I'm gonna have to like make up a visionary librarian award or something like that. But it's just thinking about, how do you take what you have? And I think that's very much the essence of, those who are connectors in your community. How can you take the people that you do know, because the library does have to partner with many different areas, and bringing that into play. Now, granted, the conversations have hopefully changed a lot in terms of funding that is available, or ways that you can kind of share resources to be able to implement these things. But we're recognizing more and more we have to think outside of the box. So, Maddie, I don't know if you can speak to like some of the partnerships and things, maybe in general, maybe outside of the library as well, just how, especially as your organization, as the American Heart Association, a lot of times people traditionally think CPR training or, during Heart Awareness Month, those types of things, but really thinking about maybe some nitty-gritty opportunities for, a nurse that may come across this, or a librarian who may come across it, some of those partnerships and what they look like, things that you can incorporate into alternative touch points.
Yes, absolutely. And I think one thing that both of you hit on and has really been important in trying to reach all communities, all people, and addressing all health issues is really finding that connection point of where we put trust in people that are not necessarily always clinical representatives. And off the top of my head, one of the initiatives that we've done recently and over the past year or so is with what we call a BB talk, and it's a barbershop and beautician talks where we use a nurse from Bonza Forest. Her name is Brandy. She's amazing, but she is someone who comes in and asks local not volunteers, but local beauticians and barbershop owners if they're interested in learning more about blood pressure. Because when going to do research and finding an outlet in which people trust, especially in reaching some diverse populations, their beautician was someone they went to regularly. It's someone that they trusted. It's someone that they had community with. It's someone that typically their whole family might have gone to the same location or place. And there was this level of trust there when it comes to something as simple, or what may seem as simple as to get your hair done, or to get your hair washed, or to get your hair cut. But what we found is that when sitting in the hairdresser's shop and sitting in there and getting through the conversation and talking, when we were able to educate these beauticians and barbers about blood pressure, they were more commonly bringing up that topic of conversation for their guests and for their clients, and which then turned into a even further conversation. So as mentioned, the nurse does reach out to the community members there at first to see if they're interested in learning more about that, in which we've had a great response of beauticians and barbers who come. They do a training over a few hours with this nurse, and then they're given all the resources, the blood pressure cuffs, and they take that with them into their shop. And then from there, they have the opportunity to continue that conversation. And if it leads to more from there as well, we can provide resources to refer them to a doctor from there if they continue, like I said, that conversation. But I think that's one great example of learning to really learn more about a specific community, meeting that community where they're at, and learning more about where they trust, who they trust, where they go regularly, and then how we can benefit them in providing resources in ways that is equally accessible for them, but also in an environment that they feel safe in and that they trust where this information is coming from. So that definitely is something that really had to think outside of the box on, and think outside of how typical ways that we would provide educational resources. And I think one thing that we've been talking about in conversation with the library as well is being able to implement something similar when it comes to blood pressure and screening people for their blood pressure, educating them about what it is, and then referring them. And I think that 3-step process is really important as well when working in these typically maybe non-traditional environments when it comes to assessing our health and working potentially with clinical representatives. But, yes, providing the opportunity to screen people, but also to really prioritizing that time to educate them as well, which can then hopefully lead to more successful rates of referring and leading people to actually making change and taking initiative when it comes to addressing their health issue.
Maddie, you're speaking my love language, by the way. I love all of that conversation, and especially too, I've gotten a chance When I was in nursing school at University of Pennsylvania, that was a lot of some senior research I did was on barbershops and using them as alternative areas to talk about blood pressure, talk about hypertension, talk about all different types of health particulars. And again, someone who goes to the hairdresser, you have that time to have that kind of conversation. And there really is a trust that comes with it. And I think that's so important in community health in general, is establishing trust, finding trust, utilizing trust, leveraging trust, but in a way that's sustainable for the community. So everything you said, it was like, makes my heart leap. Thinking about just the ways that you can do that, and just all kinds of different ways that happen. And so I think more and more with thinking outside the box in that way, recognizing that we have to reach beyond the traditional walls of what we think about reaching, and just utilizing the spaces and the resources and the partnerships that we have. And I know the same conversation has come up big with mental health as well too. Just thinking about how do we utilize the resources that we have in other areas within the community? Because that ends up still being, a bigger stigma-related conversation that still ends up being a little bit harder reaching conversation. Just thinking about, how can you utilize, and again, it's not to say that the library is going to fix everything and the library can do everything, but really recognizing, again, gems like these, whether it's barbershops, whether it's libraries, whether it's, grocery stores, whatever it is where people go, meeting people where they are, how can you address some of these things so that we can have healthier communities? One of the things that really pushed me as a community health consultant, again, by trade, I'm a pediatric nurse practitioner, but the areas that I worked in, I recognized that if the community wasn't healthy, then the kids and the caregivers that came to me, they were going to have a hard time catching up. I could do whatever I can in that small block of time that I could, but then I recognize once they go back into the community, it's a whole other ball game. I can empower them as much as I can. I can give them their clinical diagnosis in the way I could. I could use whatever resource there. But again, especially imagine, I worked in FQHCs. I worked in a lot of areas where, again, there were a lot of challenges. So me being me, I wanted to spend a lot of time, and I did not have all the time I wanted. But some of the things that needed to be done, you just needed time. You couldn't always rely that the person would come back for the follow-up visit or the next one or the next one. So there was a lot of gaps that happened. And it really caused me to kind of have this bit of a grind with what do I do with the issues that I'm seeing, and how can I do more? Where can I see, the community as a patient, so to speak, assess that community's needs and make sure if that, general system is dealt with, then maybe that can help as it trickles down to the individual, deliver care in a way that's more sustainable for them, that they are more empowered to access the care that they need, be more educated on it. So that, there's so many different thoughts that go with it. But I don't know if Deidre and even Renita, if you could speak to, number one, some of the biggest needs, especially around mental health specifically, which can also, spur into changing a lot of other things, and some innovative solutions, partnerships that have been done. Deidre, I know you're working with Healthy Lawrence County as well, and just looking, kind of trying to unpack it. We may not be able to solve everything. I'm not here to solve all the issues in the world, but really just try to unpack some of those things and think through, what's one step we can take to figure this out?
I think one of the biggest concerns that we're seeing, and I will say this off the jump, that I appreciate the fact that mental health is more of a conversation piece now, with the recent pandemics and all that has come from that. We are talking more freely about mental health, but the flip side of that is there's a lot of information out there that's just wrong. It's just incorrect. So we have people who are meaning well and they're not accurate. So when it comes to what do we do, I think the biggest conversation right now is how do we accurately educate our community about mental health and what that looked like and what that means, because it's not just mental illness. It's not just I have a diagnosis from the doctor, because there's many a time we've just been under extreme stress, and if I don't have the coping skills to handle that, it's going to affect every other part of my life. So what we're finding for a lot of mental health practitioners is we're having people who may not necessarily fit your traditional diagnoses, but they're experiencing life in such a way that we've never experienced it before. And they're not equipped. They don't know what to do. They don't know how to handle it. So they will find a Miss Renita at the library and say, hey, I'm lost. I don't know what to do. And I'm grateful that we do have that partnership and we are working on some things because people trust her. Another area that I'm finding where a lot of trust is, especially in the African American community, is churches and pastors and leaders. And that's one of my target areas. If I can educate the pastors, then we're going to reach people in a way that they understand, in a way that resonates with them. So again, those touchstone places where we don't normally put a mental health conversation, a healthcare connection. If we kind of look at some of the communities, even in our area, you'll find a church on every corner before you find a doctor's office. So and mental health practitioners are very few and far in between. So trying to fill in the gaps, and that's one of the things Healthy Lawrence is trying to do, is how do we fill in the gap, utilizing those areas that are already in place. Can we train pastors to recognize mental health issues? Can we train youth workers and youth leaders to do more with mental health first aid for youth or something like that? Because that's definitely where we start. We got to look at what we have available, what programs already exist, and how we can work together to enhance. I always say we're better together. So whatever one organization is doing, if I can partner with someone else, it's going to enhance both of us and not just be one-sided. So starting with what we already have, no point in reinventing the wheel. If we start where we are and build on those foundations, I think we'll come to a point where we see better care, better connection, better access, and less of a stigma.
Right, definitely so. And I know, Renita, you probably have some additional insight into that, some of the things that you've specifically seen firsthand in that conversation, anything else in between. So feel free to jump all over it.
Right. And I was going to jump on that because I remember when I was in Tennessee, we were dealing with people. We wanted people to stop smoking. That's the thing. Stop smoking. Smoking is bad. So people were not going to the health department for these classes. Who would want to go to the health department? I don't think anybody wants to raise their hand and say, I was called at the health department. So what I did was I partnered with them and I became the facility. So then people could come to the smoking cessation class. So the numbers jumped because they didn't want to be caught at the health department, but they felt comfortable enough to come to the library because you can bring your kids. The kids could be reading books while you're getting those tools to stop smoking. And I'm all about that partnership. Partnership is so important because the thing is, once again, I have a small budget. So the things I have to think outside the box. So I would love to have nurses come in and do educational classes. Like once a month, we'll have like, this is what we're going to talk about. We're going to have heart health this month. Have a nurse come in so my patients will know this month we're going to learn about the heart and learn how to, do better. So then they can feel comfortable asking questions. Because a lot of times what happens is these people go to the doctor, but they're scared to ask their doctor questions. So let's provide a space so they can feel comfortable to ask those questions, because no question is a dumb question. I always say my doctor gets tired of me. So I'm like, so I read on my chart this. What does that mean? But some people are scared to do that. So we can create a space where we can have a nurse or a social worker to come in and be like, between these hours, we'll be here to answer questions, or just any type of situation. I would love to see that partnership. And also dealing with stress, because a lot of times people don't realize stress affects everything in your body. I'm learning that because I didn't realize I was stressed at some point, and my grandma was like, you are stressed. I need you to breathe. But stress plays a major role and like someone said, we don't know how to cope. Like I had to ask my doctor, how do I cope with stress? And they're like, you're doing too much, so I need you to breathe. Breathing techniques. And this would be great to have someone who is a healthcare provider to tell us how to handle stress, because after the pandemic, our stress level has went up. Like I said, the world that we live in is different. Even as a librarian, like when the pandemic happened, I was shut down. I was in North Carolina, the only one in my library, and trying to figure out, how do I make this work? How do I still give resources? And I'm the only one in this building. My stress level went through the roof. I didn't know if I was going or coming. So dealing with my doctor and talking to them, I was able to hope and be like, breathe, you prioritize, you figure out what you can do, and what you can't do, you just can't do.
Mm-hmm.
And that's the thing that we need to learn. We need to learn that stress is a good thing, but we also have to know how to manage it and prioritize stress because I don't want you to become overwhelmed. And also another thing that we deal with at the library is in Lawrence County, I realized that there's no space for our kids. There's nothing for our kids to do. So they are stressed all the time because either you go to school, you go home. If your parents can't afford the Y, what is there for them to do? So the library is trying to provide a space where they can feel safe to express themselves, a space where they can have fun and feel like they can have a situation where they can have fun with their friends in a safe environment. So that's the one with safe environment. And then we realized through this situation, we realized these kids also have issues as well because of the fact they don't feel safe to express themselves. And I've learned several of them don't have good home lives. And so now you put us as librarians in a situation because now you said something and now I have to do a welfare check. Now we got to make sure you're okay. And now we're waiting at the door to make sure you come here, or do we need to call the police? So these things, we're seeing these challenges every day. So I would love to, be able to partner with the police department, with nurses. So for our kids can feel safe to be like, this is what's going on in my home. And I feel safe enough to express it here at the library because I know that my issues are going to be met and helped.
That is rich. That is rich. And I definitely feel like this is going to need to be a part 3, 4, and 5, and 6 as we go forward and thinking about it, because there's so many things that you can touch on that. And, obviously we don't have that much time left. And so it's just thinking about so many different things to think about. And I love that you spoke to, nurses, police department, social worker, and everyone else in between. And I think that's the big thing, recognizing that we really have to come into these kind of wraparound moments. This is a part of being, good stewards of our communities. This is a part of being a visionary. This is a part of being, forward thinking and just where we are right now. And I think these points bring up such good opportunities to say, okay, now that we know it's out there, what do we do? Hannah talked about the policy piece, thinking about policies, thinking about systems, thinking about education, thinking about, maybe the concept of the medical home model has to go beyond just the medical home. It may have to go beyond the primary care clinic. You might have to create these different hubs in order to create these services and these opportunities. It may not be able to do everything, but at least to deliver something so that, we know there's big issues with frequency to the emergency department. We know there's frequency of, non-compliance and showing up to appointments and those types of things. As you pointed out, Renita, people are coming to you. They're saying, hey, I got this thing going on. And it might just seem like passing conversation, but you still are required to do something about it. And so we see this happening more and more and more. And, on one side, it's not for healthcare providers to be even more stressed and say, oh no, we got more stuff going on. For community members to say, okay, now what do we do? Because here we are and, all these issues that are happening. But it's just for each person to be able to figure out, where's my strength in this? How do I fit into that puzzle piece? I know I may not be able to do everything, but as you said, here's the big priority issues. How can we separate into, what's emergent, what's urgent, what's necessary, what's important, what's low threshold. Again, very much looking at the community in a patient level, assessing that community, creating that plan, thinking about that community's needs, what kind of follow-up do you need to have, and then what can you do now? And that's something that I always bring up, especially on the coaching side of things when I do as a coaching consultant and a mentor for nurses and other healthcare professionals. Now that all this stuff is out here, what's the one next step you can take? What's the one next step? Do you already, if you're a librarian that's listening or someone who may be, working on the policy side and you want to implement funding, what's the one next step? Can you suggest, some of the funding being diverted towards libraries who have these kinds of ideas? And we know there's, some of these grants that are surfacing, but it's sometimes not enough funding to go around. If you know that you are a nurse that is in, maybe in care coordination or in community health, and you're looking for other projects or ways that you can involve yourself in the community, hey, Lawrence County directors all open for this. Thinking about how you can do education in those areas, or, with the American Heart Association, being able to put some of those pieces for the screen, the refer and the educate in there. Look for your local mental health practitioner, your counselor. There's so many different pieces of it. And so it's finding those ways to coordinate those things. Again, this is my love language. I love doing these types of things. And for those nurses who say, hey, I want to care coordinate from a systems level. I may be burnt out at the bedside, but how can I transfer some of the skill set that I've had and look at it from a systems level and say, let me care coordinate across organizations, because I know, what that person might need because of being in the healthcare system, knowing on an individual level and providing that in an organizational level. So there's so many different ways you can look at it, so many different ways you can put it together. Unfortunately, we can't talk about it more and more and more because, again, we probably have like a 5-hour convention at that point, which, hey, that might be the next thing on the list to do. So, you heard it here first when you see that coming down the pipeline. But I don't know, if anyone could just, any last minute thoughts you have, things you want to promote, innovative solutions you think, any last thoughts that you want to share, just thinking about this conversation. And again, I definitely think we'll have to continue this conversation. I so appreciate you just adding to the conversation, but any kind of last thoughts to kind of throw out there or think through, what's that one next step that we take at this point?
I think the biggest thing, we can talk. A lot of people talk. Just do it. Mm-hmm. Just start somewhere. Even if it's you and one other person, even if it's you and that one other friend, and neither one of you have a quote unquote organization you're connected with, make a phone call. Sometimes it's really as simple as saying, hey, I have this idea. Are you willing to work with me? Simplicity really is key. So if anyone is listening and they're trying to figure out, what do I do in my community? How can I, bring about some change? Just start the conversation, and you'd be surprised at who else is having that conversation in private, who else is having those thoughts, who else has been wondering and waiting for somebody else to kickstart the idea. So as the Nike saying is, just do it. Don't wait. Don't procrastinate. Don't keep putting it off. Yes, it's you. If it's on your mind, if it's on your heart, yes, it's your baby. Go for it and watch it blossom.
So good.
I would definitely second that, Deidre. I was thinking kind of the same exact thing. Like sometimes I just have to remind myself to take action, and that we don't have to keep talking about it. Let's just do it. But I think on top of that too, especially with the American Heart Association going in to, as I mentioned earlier, our centennial, 100 years. There's been 100 years of so many good things, yet there's still work to be done. And I think sometimes in our roles, and as we've discussed today, it's also important to step back and think about making change long term, and how we have to take that action today. And we might not see exact explicit results tomorrow, but looking into how we're making change for the many years to come, entering into the second century, and how long term we're making impact, policy change, improvements, whatever it may be. Because I know at times you can kind of get bogged down and maybe a little bit burnout and not being able to see tangible change all the time, but also reminding yourself of the value of the work you're doing, the value and the action that you're taking, and how at some point, somewhere, someone is going to be impacted by that. And I think that's always important to remember.
Yes, so true. And Maddie, you might have been checking out my reels recently. Maybe you probably didn't. You probably didn't even know I had them. But on the Vision Earners Instagram page, I literally said that exact same thing. It's just that reflection point. So, thanks for backing up what I was definitely putting out there. And that's the big thing with community change and community health, and anything that you want to do that's not as easily seen right away. You can get bogged down in the details. You can get bogged down in the day-to-day. You can have these great, big thinking conversations, but then, like Deidre said, like you said, Maddie, you have to take that one step. And sometimes we want that one step to be like, yes, this has done everything that I need to be done. But sometimes it's not. But it does not mean that it's not effective. It does not mean that it's not changing, the entire trajectory of what you need to do. When we think about, those big metaphysical, metaphorical conversations of like turning a ship, my dad used to be in the Navy. It's a slow process, but once it's turned, you have changed the entire course of whatever that thing is getting ready to do, and everything else that's on it. So I think for those of us who are in the community health space and community engagement sphere, those who are right in our local areas, it could feel like you're changing, turning a ship that is massive, the size of a nation, but just start turning it, because the thing that turns it is super small. It's that tiny little thing that's going to start turning that ship. So, I think that speaks to so highly as well, Maddie, is just thinking about, moments where you have to step back, give yourself space, think about what's happening, celebrate your wins, figure out, okay, here's what we've accomplished today, but let me not let that stop me to, go to whatever the next thing is tomorrow. So, thank you, Maddie, Deidre, Renita, Hannah. Thank you so much for being on this conversation, for being a part of the Visionary Nurse podcast, for sharing your thoughts, for thinking about, taking those steps with me as I throw them out there as well. The things that we have gotten a chance to talk about, the things that we've already gotten a chance to do, whether big or small, those things are paving the way for, a whole new trajectory of things. So I look forward to more conversations to come as we think about it. So that's all the time we have today on the Visionary Nurse podcast. Today's episode was really focused on thinking about the power in partnership, thinking about community engagement, thinking about how we can really take some of these alternative touch points and utilize the spaces, the places, the conversations to partner, to bring in that cross-sectoral collaboration so we can really meet people where they are. So again, my name is Antoinette Montalvo, your host of the Visionary Nurse podcast. And just the purpose and just the passion behind this podcast is to educate, uplift, and support each other as we dare to be influentially visionary. So stay visionary, take that next step, and we'll talk to you all next time. Bye-bye.